This is a Trident Disabilities audio archive recording for New Disabled South, read by Angela Luttrell on April 23, 2024. South Carolina Senate Bill 915, Executive Office of Health and Policy. Sponsors: Harvey Peeler, Republican District 14, Brad Hutto, Democratic District 40, Sandy Sen, Republican District 41, Nikki Seltzer, Democratic District 26, Josh Kimbrell, Republican District 11, Mike Fanning, Democratic District 17, Danny Verdon, Republican District 9, and Tom Young, Republican District 24. Bill status: January 9th, Senate introduced and read first time. January 9, 2024, Senate introduced and read first time. January 9, 2024, referred to Committee on Medical Affairs. February 13, 2024, Committee Report, favorable with amendment, Medical Affairs. February 14, 2024, Special Order set for February 14, 2024. February 20th, 2024, Committee Amendment adopted. February 20th, 2024, amended. February 20th, 2024, read second time. February 20th, 2024, roll call, ayes 42, nays 1. February 21st, 2024, read third time and sent to House. February 21st, 2024, roll call, ayes 44, nays 1. February 21st, 2024, South Carolina Legislator, Scrivener's error corrected. February 27, 2024, House introduced and read first time. February 27, 2024, House referred to Committee on Judiciary. And April 23, 2024, House Committee Report, favorable with amendment, Judiciary. About this bill. This bill will create the Executive Office of Health and Policy. The Executive Office of Health and Policy will replace the State Department of Health. Important terms: Secretary, the Secretary of Health and Policy. Office, Executive Office of Health and Policy. State Health Plan, the state plan for the public health services put together by the Secretary of Health and Policy. The Secretary of Health and Policy will be the leader of the Executive Office of Health and Policy. The Secretary will create the State Health Services Plan. The plan helps make sure everyone gets good health care. It's a blueprint that shows how to make health care in the better. The plan wants to make sure there are enough doctors and nurses and that hospitals have everything they need to help people. It also helps disabled people get the help they need in their own community so they do not have to live in institutions. To create the plan, the Secretary will have help from a special group of people who know a lot about healthcare. The Secretary will choose a South Carolina Director of Community Living Integration who will look at how well communities in South Carolina include disabled people. The Director of Community Living will help create goals for including disabled people in community for the State Health Services Plan. The Secretary and Director of Community Living will listen to disabled people and their families to make sure everyone's needs are met. The Secretary makes sure the rules and services are good. They also give health advice to the public. The Secretary puts together services and hires workers. The Secretary also decides what kind of treatment someone needs if they have a complicated health problem. The office is made up of different government organizations, including the Department of Health Financing, the Department of Public Health, the Department of Aging, the Department of Intellectual and Related Disabilities, and the Department of Behavioral Health and Substance Abuse Services. Each department will have a director to make decisions and lead it. The Secretary is in charge of the office's budget. The directors of the current departments will stay on as short-term department directors until the Secretary finds their replacement. The Secretary will decide who the directors are and which workers will stay in each department. All the policies and partnerships under the State Department of Health will continue under the Executive Office of Health and Policy. The changes will become law when the governor approves it.